Hello, I'm Dr. Claudeanos, and I'll be speaking today about varicose veins, a very common problem that we see in the vascular surgeon's office. It causes multiple debilitating, sometimes symptoms in patients. Besides them being unsightly to many, it can cause leg heaviness and aching, pain, discomfort, swelling even, as well as skin changes. And the final, most severe forms, ulceration, which we try to prevent. The hallmark of treatment for varicose veins is based on the quality and intensity of the symptoms involved for the patient. A patient that has no symptoms and just has varicose veins usually requires no treatment. Most of those patients, when they come to the office, I do recommend compression stocking therapy for them because a lot of them will notice that their legs feel better with the compression stockings. These are usually not the over-the-counter ones that you can buy, but these are actually prescription grade, usually 20 to 30 millimeters of mercury specifically. But we do try a conservative period of treatment for this before we recommend any treatment. Then this covers a couple of issues. One, we want to try anything that doesn't involve an intervention first, and if that is enough, great, because that doesn't have any risk. Two, it does fulfill a lot of the insurance obligations and approvals that we have to negotiate through before we can have your insurance approve these procedures. Once we do find that somebody's symptoms have not been improved with compression stockings, we will do an ultrasound that tests how well your veins are working, and that shows us actually the valves inside the veins are usually the culprit in this. If those are shown to be faulty, or your veins are usually bigger than normal, then that helps us get approval for procedure. And I would say the standard of care is not, it used to be vein stripping, which was a quite painful procedure, but now we can treat this in an in-office procedure using heat to close the vein, and this is commonly referred in our practice. Radiofrequency ablation is the technique that we use, which takes less than an hour, and usually patients come in, have their procedure done, and are able to walk later that day and go home within probably an hour or two after the procedure. The residual varicose veins, if they are there and still causing problems, we occasionally go in and remove those directly through a small surgical procedure.